Welcome to today's video about symptoms of endometriosis. Have you ever felt an ache deep in your body that no one could explain? Or maybe your periods are so intense they knock you off your feet, but every test comes back normal. What if the real issue is something millions of women live with, silently? Over 190 million women worldwide are affected by it, yet many still go undiagnosed for years. Why? Here's a thought. What if one of the most painful, life-altering conditions in women's health is also one of the least understood? We're talking about endometriosis, a condition that doesn't just affect your body, but your emotions, your relationships, and your daily life. And here's the twist. Some of its symptoms might be showing up in ways you'd never expect. In this video, we're digging into the real signs your body could be giving you. Backed by science, we'll uncover surprising research, stories that hit home, and symptoms that go way beyond just painful periods. One of them might even be something you thought was totally unrelated. Stick with us until the end. We've saved the most overlooked sign for last, and it might just open your eyes. Hit that like button and subscribe. Your journey to clarity starts now. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, let's break down the key symptoms of endometriosis, starting right at number 1. Pelvic pain. Many women endure intense lower abdominal pain during their periods, often dismissing it as a normal part of menstruation. However, for some, this pain is a sign of something more serious: endometriosis. In this condition, tissue similar to the uterine lining grows outside the uterus, leading to inflammation and discomfort. Recent research has shed light on the profound impact of this condition. A study published in the Journal of Endometriosis and Pelvic Pain Disorders in 2023 found that women with endometriosis often experience chronic pelvic pain that significantly affects their quality of life, including their ability to work and engage in daily activities. The pain isn't limited to menstruation. Many women report experiencing discomfort at various times throughout their cycle, making it a constant presence in their lives. This persistent pain can be debilitating, leading to missed work days and social activities. It's crucial to recognize that severe menstrual pain isn't something to be ignored. If you're experiencing ongoing pelvic discomfort, it's important to consult a healthcare professional. Early intervention can lead to better management of symptoms and improved quality of life. Next, number 2. Pain during intercourse. Deep within the pelvis, endometriosis can silently progress, often revealing itself through discomfort during intimate moments. This pain, known as dyspareunia, isn't just a fleeting issue. It can be an early indicator of endometriosis. The discomfort arises because endometrial-like tissue, which should line the uterus, grows outside it, leading to inflammation and scarring. A recent study published in the Archives of Gynecology and Obstetrics in 2024 highlighted that many women with endometriosis experience both deep and superficial dyspareunia. Deep dyspareunia often occurs first, and when both types are present, they significantly impair sexual function and quality of life. This dual presence of pain types underscores the importance of recognizing dyspareunia as a potential early sign of endometriosis. For many, this pain isn't just physical. It can lead to emotional distress, affecting relationships and self-esteem. Recognizing and addressing these symptoms early can make a significant difference. If you're experiencing such discomfort, it's essential to consult with a healthcare professional to explore the underlying causes and appropriate interventions. Next, number 3. Heavy or irregular menstrual bleeding. Let's talk about something many women experience but often overlook: unusually heavy or unpredictable periods. If you've ever soaked through pads rapidly or had cycles that seem to come and go without warning, you're not alone. These patterns might be more than just a nuisance. They could be early signs of endometriosis. Endometriosis occurs when tissue similar to the uterine lining grows outside the uterus. This rogue tissue responds to hormonal changes, leading to inflammation and bleeding in areas where it shouldn't. Over time, this can disrupt the normal function of reproductive organs, leading to heavier and more erratic menstrual bleeding. A 2023 study published in Contemporary OB/GYN analyzed data from over 7,600 women and found that those with endometriosis were significantly more likely to report heavy menstrual bleeding and irregular cycles compared to those without the condition. This research underscores how common these symptoms are among those affected. If your periods are consistently heavy or unpredictable, it's worth paying attention. Such symptoms are not just inconvenient. They can be indicators of underlying health issues like endometriosis. Recognizing these signs early can lead to timely medical consultation and better management of your reproductive health. Next, number 4. Chronic lower back pain. Lower back pain that lingers for months, especially when it worsens around your menstrual cycle, might be more than just a muscular issue. In some women, this persistent discomfort is an early sign of endometriosis, a condition where tissue similar to the uterine lining grows outside the uterus, often on pelvic organs. This misplaced tissue doesn't just stay put, it reacts to hormonal changes, leading to inflammation and pain. When these growths are near the lower back or pelvic nerves, they can cause significant back pain. The pain isn't always confined to the pelvic area. It can radiate to the lower back, making it a hidden culprit behind chronic backaches. A study published in Gynekologia Polska in 2023 found that women with endometriosis reported significantly higher instances of lower back pain compared to those without the condition. This highlights the importance of considering endometriosis in the differential diagnosis when women present with chronic lower back pain. If you're experiencing ongoing lower back pain, especially if it's cyclical and intensifies during menstruation, it's essential to consult a healthcare professional. Early recognition and intervention can make a significant difference in managing symptoms and improving quality of life. Next, number 5. Painful bowel movements or constipation. When endometrial-like tissue grows on or near the bowel, it can disrupt normal digestive function. This tissue responds to hormonal changes, leading to inflammation and scarring. Such changes can cause the bowel to become less flexible, making it harder to pass stool and leading to discomfort during bowel movements. A study published in BMC Gastroenterology in 2023 found that women with endometriosis often experience gastrointestinal symptoms similar to those of irritable bowel syndrome, including constipation. These symptoms can be so similar that they often lead to misdiagnosis. The study highlighted that the overlap in symptoms between endometriosis and IBS is significant, emphasizing the need for careful evaluation when women present with such gastrointestinal issues. Additionally, research has shown that endometriosis can directly affect the nerves and muscles of the pelvic floor, leading to a condition known as dysynergic defecation. This condition is characterized by the inability to coordinate the muscles needed for a bowel movement, resulting in straining, a sensation of incomplete evacuation, and constipation. Such neuromuscular dysfunction further complicates bowel movements for those affected. Understanding these mechanisms is crucial for recognizing that gastrointestinal symptoms like constipation and painful bowel movements may not just be isolated digestive issues, but could be indicative of underlying conditions like endometriosis. Awareness and proper evaluation are key to addressing these symptoms effectively. Next, number 6. Painful urination. When urination starts to sting or burn, it's easy to assume a urinary tract infection is to blame. But for some women, especially those in their reproductive years, this discomfort could signal something more complex. Bladder endometriosis. Bladder endometriosis occurs when tissue similar to the uterine lining grows on or inside the bladder. This can lead to inflammation and pain during urination. Unlike typical infections, this pain often intensifies around menstruation and doesn't always respond to antibiotics. A recent study published in the Journal of Minimally Invasive Gynecology, 2024, found that among 47 patients with bladder endometriosis, 57.4% experienced urinary symptoms like painful urination, urgency, and frequency. These findings highlight the importance of considering endometriosis in patients with persistent urinary discomfort. If you've been treated multiple times for urinary infections without relief, it's worth discussing the possibility of bladder endometriosis with your healthcare provider. Early recognition can lead to more effective management and improved quality of life. Next, number 7. Infertility. For some women, the first sign of endometriosis isn't pain, it's the unexpected struggle to conceive. You might feel perfectly healthy, yet month after month, pregnancy doesn't happen. This silent form of endometriosis can quietly interfere with fertility long before any other symptoms appear. Endometriosis affects up to 50% of women facing infertility. It can cause inflammation, scar tissue, and hormonal imbalances that disrupt ovulation and embryo implantation. Even in early stages, it can alter the uterine environment, making it less receptive to a fertilized egg. A recent study published in Frontiers in Endocrinology, 2025, highlights how endometriosis-related infertility involves not just physical barriers, like adhesions, but also immune and hormonal disruptions that impair ovarian function and embryo quality. If you're experiencing unexplained infertility, it's worth discussing endometriosis with your doctor, even if you don't have pain. Early detection can open up more options for preserving fertility and finding the right treatment path. Next, number 8. Fatigue. Many women with endometriosis report an overwhelming sense of exhaustion that goes beyond typical tiredness. This persistent fatigue can be one of the earliest signs of the condition, often preceding other more recognized symptoms. A recent international survey involving 2,907 participants highlighted that fatigue significantly worsens during menstruation, with a median score of -2 on a scale where negative values indicate worsening symptoms. Interestingly, common treatments like hormonal therapies and pain medications showed limited effectiveness in alleviating this fatigue. In some cases, treatments such as gonadotropin-releasing hormone agonists were associated with worsened fatigue in over half of the users. Further research utilizing wearable technology monitored 68 individuals with endometriosis over several weeks. The study found a strong negative correlation between daily physical activity and self-reported fatigue levels. Participants experiencing more severe or variable symptoms displayed lower levels of physical activity and greater sleep disturbances. These findings underscore the importance of recognizing fatigue as a significant early symptom of endometriosis. Addressing this fatigue requires a comprehensive approach that goes beyond traditional pain management, considering factors like sleep quality, physical activity, and overall well-being. Next, number 9. Bloating. Many individuals notice their abdomen swelling, often resembling pregnancy, especially around their menstrual cycle. This isn't just typical bloating, it's a distinct phenomenon known as endobelly, commonly linked to endometriosis. In a 2023 international survey, 92% of participants with endometriosis reported experiencing bloating, making it one of the most prevalent symptoms. This bloating isn't merely about gas or digestion. It's a result of endometrial-like tissue growing outside the uterus. These tissues respond to hormonal changes, leading to inflammation and swelling in the abdominal area. This inflammation can cause the abdomen to feel tight, hard, and visibly distended. Moreover, this bloating can be persistent and doesn't always correlate with food intake or typical digestive issues. It's often accompanied by discomfort and can significantly impact daily activities. Recognizing this pattern is crucial, as it can be an early indicator of endometriosis, prompting individuals to seek medical advice and further evaluation. Next, number 10. Nausea or vomiting. During periods, experiencing nausea or vomiting during your period can be more than just a passing discomfort. For some, it's an early sign of endometriosis, a condition where tissue similar to the uterine lining grows outside the uterus. One reason for this is the proximity of endometrial lesions to the gastrointestinal, or GI, tract. When these lesions are near or on the bowels, they can irritate the GI system, leading to symptoms like nausea and vomiting. A study published in the Journal for Nurse Practitioners found that women with bowel-associated endometriosis lesions reported increased nausea and vomiting compared to those without such lesions. Additionally, during menstruation, the body releases prostaglandins, hormone-like substances that help the uterus contract to shed its lining. In women with endometriosis, higher levels of prostaglandins can lead to more intense uterine contractions, which may cause nausea and vomiting. This mechanism is similar to what's observed in primary dysmenorrhea, where elevated prostaglandin levels are linked to menstrual pain and associated symptoms like nausea. It's also worth noting that endometriosis can mimic or coexist with irritable bowel syndrome, a condition characterized by GI symptoms such as nausea, bloating, and altered bowel habits. This overlap can make it challenging to pinpoint the exact cause of GI symptoms during menstruation. However, the presence of nausea and vomiting specifically during periods, especially when accompanied by other signs of endometriosis, should prompt further medical evaluation. If you find that these symptoms are recurring with your menstrual cycle, it's important to consult a healthcare provider. Early recognition and management of endometriosis can significantly improve quality of life and prevent potential complications. Next, number 11. Leg pain or sciatica. A woman in her early 40s began noticing a dull ache in her right leg that intensified during her menstrual cycle. Over time, this discomfort escalated to sharp shooting pains radiating from her lower back down to her foot, accompanied by tingling and occasional numbness. Despite multiple consultations with neurologists and orthopedists, no definitive cause was identified. Eventually, an MRI revealed a lesion on her sciatic nerve, which was diagnosed as endometriosis. Following treatment with gonadotropin-releasing hormone analogs, her symptoms significantly improved, and the lesion reduced in size. This case underscores how endometriosis, typically associated with pelvic pain, can manifest in less common ways. When endometrial-like tissue grows near or on the sciatic nerve, it can lead to symptoms resembling sciatica, pain, numbness, or weakness in the leg. Such presentations are rare but noteworthy, as they can be misdiagnosed or overlooked, leading to prolonged discomfort and potential nerve damage. A study published in Medicina in 2023 highlighted that isolated deep infiltrating endometriosis of the sciatic nerve, though uncommon, can occur without other pelvic involvement. This emphasizes the importance of considering endometriosis in the differential diagnosis when women of reproductive age present with unexplained sciatic symptoms. If you or someone you know experiences cyclical leg pain, especially if it worsens during menstruation, it's crucial to consult a healthcare professional. Early recognition and intervention can prevent complications and improve quality of life. Next, number 12. Pain when sitting or standing long periods. Sitting through a work meeting or standing in a queue might seem routine, but for some women, these simple acts can trigger deep, aching pain. This isn't just discomfort, it's a potential early sign of endometriosis. Endometriosis occurs when tissue similar to the uterine lining grows outside the uterus, often affecting areas like the pelvic floor, lower back, and hips. These tissues can become inflamed and form adhesions, leading to stiffness and pain that intensify with prolonged sitting or standing. Over time, this can make everyday activities feel like a physical challenge. A 2024 study published in the Journal of Minimally Invasive Gynecology, highlighted that women with endometriosis often report significant discomfort during routine postures, such as sitting or standing, due to the musculoskeletal impact of the disease. If you've been noticing that extended periods of sitting or standing are causing persistent pain, it's essential to pay attention. Such experiences aren't merely inconveniences. They could be your body's way of signaling an underlying issue like endometriosis. Next, number 13. Mood swings or depression. Many women with endometriosis experience emotional challenges that often go unrecognized. These emotional shifts aren't merely reactions to physical discomfort. They may be integral to the condition itself. A 2023 systematic review published in Frontiers in Public Health analyzed 18 studies and found that depressive symptoms were present in up to 98.5% of women with endometriosis. This high prevalence suggests a strong link between endometriosis and mental health challenges. The review also highlighted that the quality of life in patients with endometriosis was significantly impaired, regardless of the evaluation tool used. Further research indicates that the relationship between endometriosis and mood disorders may be bidirectional. A 2024 study in Frontiers in Medicine described a vicious cycle where endometriosis-related changes and infertility lead to depression, which in turn induces physiological and immunological changes that can exacerbate endometriosis. Understanding these connections is crucial. Recognizing mood swings or depression as potential early indicators of endometriosis can lead to more comprehensive care. Addressing both the physical and emotional aspects of the condition may improve overall outcomes for those affected. That's it for today's video. If any of these symptoms hit close to home, you're not alone. Endometriosis is real, and speaking up about it matters. Have you been through this journey? Share your experience in the comments. How do you manage the pain or emotional toll? Your story could help someone else feel seen. And if this video helped you understand things a bit more, type "helpful" in the comment box. It truly motivates us to keep creating content that empowers and informs. Don't forget to like, subscribe, and hit that bell icon so you never miss what's coming next. Your health matters, and we're here for you every step of the way. See you in the next one.